I'm Riley Reese. This is the Sophia Unfiltered podcast, where we bring together thought leaders, wellness entrepreneurs, makers, and emerging health leaders. We're here to have raw, unfiltered conversations because sharing your stories has the power to change lives, help others heal, and transform the way we take care of ourselves. Here we go. Hi, everybody, and welcome back to another episode of Sophia Unfiltered. Today, we have a very special guest, Dr. Meghan Beier. She is a psychologist who specializes in multiple sclerosis at Johns Hopkins University School of Medicine. Dr. Beier completed her PhD in clinical psychology with a specialization in health and neuropsychology. She then completed a postdoctoral fellowship at the University of Washington, where she focused on rehabilitation, cognition, and mental health in individuals living with MS. Her passion for increasing access to mental health care is a focus of research, clinical care, and now her website, findempathy.com. Meghan, welcome. We are super excited to have you.
Very happy to be here.
Do you want to jump right in and give us a little overview of how you got here and just this amazing journey that you've had?
Sure. Yeah. I think it all started, I'll say my family is a family of physicians. And so I always knew I didn't want to be a doctor, but I knew that I really liked the medical field. I've always had kind of a passion for mental health and how the brain interacts with our emotions in our body. And so when I learned that there were doctoral programs in health psychology, I thought, that sounds like the right fit for me. But I didn't go right into grad school. I actually worked for a year in a brain injury rehabilitation center. So basically, it was supervised apartments for people living with traumatic brain injury. And I think the thing that I loved about that experience was I was a direct care worker, which meant that I helped people remember to take their medications. I drove them to doctor's appointments. I helped them with grocery shopping. And I just kept hearing again and again about these individuals who needed some extra support in terms of independent living, but they also were the same person that they were prior to their injury, right? They wanted people to view them as the person that they were. They wanted people to view them as a person with worth and somebody with value. And they didn't want people just to see their injury. And so that was a huge thing for me. I really wanted to incorporate that into my graduate program. So kind of fast forwarding into that, I got into health psychology. I sort of fell into working with multiple sclerosis and fell in love with that population. And so it kind of took me on the rest of the journey. But I'll pause there and just see if you have any follow-up questions.
It's just so incredible. Like listening to your experience with what led you into your specified field. You said that you noticed that people were still wanting to be treated as a whole person rather than a diagnosis who also happens to be a person. Mm-hmm. So I would love to hear expand a little bit more on that, because I just feel like there's so much truth to that statement where when somebody is diagnosed with an injury or a chronic illness, they become the embodiment of that quote unquote diagnosis to that injury rather than remaining the person that they were and also having this injury or this diagnosis.
Yeah, I think it's something that needs to be incorporated. So there's a great psychologist that I've learned a lot from. Her name is Rosalind Kolb. And she, when she gives talks, puts up this image where it looks like a person that's broken into puzzle pieces. And then the illness is this new puzzle piece that kind of has to get fit into the overall picture, right? And I think that as psychologists who work with people with medical condition, that's our role, is to help somebody find a place for this new puzzle piece, but it's not the whole picture. And so to me, I think, even in multiple sclerosis right now, a good example of how people kind of get treated like the diagnosis is often when they're in a work environment, right? Where their diagnosis gets disclosed and then all of a sudden the picture shifts. Now, this isn't true for everyone, but I've seen it often enough that it happens too often, where it's all because every mistake becomes a mistake that's because of their diagnosis, or everything is seen through the lens of their diagnosis from other people, and sometimes even from the person who's living with it. So my goal in working with people is, how does this become a part of your life that we have to manage, but it's not your whole life. It's just one piece of it.
Why do you think that is the case, that everything becomes because of the diagnosis? Where do you think that comes from?
I think that there's maybe two pieces. One is, I think we live in a society where you have to sort of be wholly healthy, if you will, to be seen as, I don't want to say worthy, but kind of, it's almost like I need to get rid of this diagnosis in order for my life to be quote unquote normal. And I think that's a very ableist mindset, but I think a lot of the medical field works in that as well, right? We need to give you a pill or a treatment to make this go away in order for you to live a full life. And so, really what we're trying to do, especially in the realm of rehabilitation psychology, where it's about living with a diagnosis for your entire life, it's you don't have to get rid of this in order to live a full life. It has an impact. It's something that we need to manage, but it doesn't have to be something that takes over your entire life.
Also, ableist mindset, you were talking about that, but that also seems like, stigmas, and I feel like, something that I didn't think of before, which we know is that in the healthcare system, it's like, okay, surgery, pills, get past it, rather than embracing it. I'm not sure what else we can do as a society to get past that. How do we get past these stigmas?
Yeah, that's a really good question. I wish I had the answer for that.
Right.
I have lots of conversations with colleagues about that.
What's so interesting is I feel like you essentially summarized and encapsulated what so much of Western medicine and our society and our Western culture looks at, which is it's easy to compartmentalize things when it's in this framed mindset of all or nothing. Like you were saying, where it's like, oh, well, you're either wholly well and wellness is defined with X amount of expectations, or you are ill, and ill is defined as a set amount of expectations. We've lost the use of the word "and" when we're looking at the whole picture. And so I think that it's so amazing that you're walking into the wellness space with, like you said, trying to help people not see their entire being colored by this all or nothing notion around diagnoses, navigating illnesses and injuries, but rather, how do we fit this new piece into the puzzle and allow you to continue to thrive and cultivate a lifestyle with beautiful, meaningful relationships and connections and so forth?
Absolutely. Yeah. It's funny because I didn't get a lot of training in dialectical behavior therapy when I was in graduate school, and really only started to explore that post all of my training, because it was really thought to be something that was focused on people with personality disorders or with serious mental illness. And the more I dive into it, the more I think that this is a really good theory, or pieces of it, for people living with chronic medical conditions, exactly for what you just said, the "and" word, right? It's radical acceptance, and it's finding a way to move forward. It's living with something that's really challenging, and there's lots of feelings that go along with that. And it's focusing on the future and how I can live and thrive in a valued life. So the "and" word is so important, because I think many times the people I work with get stuck in I have to always be doing something to better myself, or I'm just stuck and there's nothing I can do. And so we want to kind of pull in both sides of that. And sometimes it might be moving in and out of those two sides.
Yeah, beautifully said. So going back, Meghan, do you want to tell us how you got into the MS realm?
Sure. Yeah. So I had originally thought that I would go into work with traumatic brain injury, because that's where I started pre-graduate school. And I really found a lot of value in working with individuals, the individuals that I worked with at Bancroft NeuroHealth. And I think my second year of grad school, one of my professors worked as the director of an MS center, the mental health side of a MS center. And he was looking for people to pull in and do some clinical work. And I was looking for a clinical placement. And so I said, sure, I'll try it, and I went in there, and I think there was two things that really struck me. One is that there is a lot of research for brain injury, and there is a lot of research for stroke, and there is a lot of research around dementia. At the time, I think we're in a different place now because that was 2007, more than 10 years ago now. There wasn't a lot of research for how do you manage both the cognitive and emotional sides of living with multiple sclerosis. And so that part was intriguing to me. Why do we have so much research in these other areas, but not for things like MS? And then the other piece of it was that people with MS were so motivated. Now, I can't make a statement across the board, but there's variability in every diagnosis. But what I found when I was working with people with MS is that they really wanted to focus on wellness. That was really important to them. And so the idea of bringing in a mental health provider was not a scary thing. It wasn't a thing that was taboo. It was actually, really encouraged. And so to me, it was a kind of melding of two worlds, right? That idea of there's some mental health and emotional sides here. There's some cognitive sides. And so, and there are people who are kind of wanting it. And I think since that time, what we've learned is that at the time we thought maybe there was somewhere around, 500,000 people living with MS. And now we know it's more like 1 million. And about 50% of those people have a diagnosable depression at some point in their lifetime. And about a third of them will have a diagnosable anxiety disorder, and 65% have cognitive challenges. So there's a huge need for mental health providers to work with people that have multiple sclerosis and their families and everybody who's impacted by it. So I just think it's a really meaningful place to work. And you can tell I'm a little bit passionate about it. And I think there's probably a lot of different meaningful groups to work with, but I just fell in love with working with MS.
So this is really interesting facts. I think this is interesting. And it's also striking that you said this population is actually really open to wellness and mental wellness and bringing in how do we deal with both sides, the cognitive and the emotional. So I'm just curious, do you think this is true for other populations? I feel like we're seeing this now across the board. What are your thoughts on that?
I think so. I think that demand is growing. That's kind of what I've seen over the course of the last 10 to 15 years. Certainly it's been there in populations like cancer, right? There was a real big push for wellness even many years ago. I think that's starting to come across in other diagnoses where you're living with something for a long time. The National MS Society did a big social media sort of dig a few years back, and they looked at what people were asking for, and the number one thing was wellness. So there was a lot of push about what medications people should be on and all that kind of thing. And they kind of shifted some of their perspective and education because what people were looking for was, how do I live with this? How do I manage the fatigue, the cognitive, the emotional things? And it's not just about medications.
Well, and I think that that's kind of the really interesting thing that you guys are probably exploring is this connection to wellness and seeing how to expand beyond symptom management is probably just this huge field that's exploding. Because from what you're saying, it really feels like the people that you're working with in your specific population group being diagnosed with MS, it sounds like not only are they seeking additional support for managing their symptoms, but they're clearly making connections that by improving lifestyle, by improving mental, physical, and emotional support, that it's not only helping them manage their symptoms, but it's also improving their overall well-being.
Mm-hmm. Yeah, absolutely. And I think that, we've been stuck in a mindset where it's, kind of there's wellness over here and there's medicine over here. I know I kind of touched on this already, but I do think that the two can be integrated, right? When people eat better, when they exercise more, when they get more sleep, when they do all those kind of wellness things, their outcomes are better. when they're on their medications, their outcomes are better. When you put all of that together into one package, their outcomes are even, better. The wrong word there, but you get what I'm saying. I think, there's a place where we can all work together and improve people's lives on a number of levels.
Absolutely. That's literally the premise behind Sophia Health is how do we get this balance of it's not just wellness for the super healthy or over here and put people in these categories and these buckets, but how do we really integrate these different practices, which could be to self-care? How do we take care of ourselves better for improved wellness outcomes, our whole health? Absolutely. Well, jumping right in, right, for the challenges. I mean, you've worked in these populations for a very long time. And this is a Sophia Unfiltered podcast. So we want to share with everybody listening, right, powerful, honest, real conversations, right? Our goal is to make these conversations more normal. So when we face them, we're not alone and we know what we can do. So with that, let's jump into the challenges of living with a serious medical diagnosis, such as a chronic illness or a disability. What are some of the challenges that you've seen specifically with this population?
Yeah, I mean, I think that there's a few different challenges that people face when they're living with a chronic illness or a disability. One of it is sort of reintegrating kind of a new pathway. So for example, somebody might have envisioned a certain future for themselves, and then all of a sudden they are diagnosed with something, or they have a spinal cord injury or a brain injury or something that happens, and that trajectory needs to shift in some way. And so I think sometimes the grief of what could have been, the grief of having to change a trajectory, and then even just sort of grieving the loss of function. All of those things are very common for the people that I work with. I think another thing is that there's this sense of what, I think it was said, like what could have been versus what is. And then there's also this idea of having to come up with, how do I live a new life? So there's the grief side of it. And then there's really actually the practical side. I mean, I kind of explain it like this when I work with people is that, I'm not living with a disability in the same way that many of my patients are. But if I were to go to a totally new place, a new city, I'm probably going to be more cognitively fatigued. I'm probably going to have a lot more stress, and I'm probably going to have to be really cognizant of where I am, how to get from point A to point B, and how to kind of navigate this new city that I've never been in. When you're diagnosed with something like multiple sclerosis or any other kind of challenging medical condition, all of a sudden you have to relearn how to live life on a day-to-day basis, right? So most of us can go on autopilot, right? We don't have to think about when to get up in the morning, when to drive to work, how to get dressed. Now you have to relearn all of those things. And it may be those small annoyances that show up every day. And that's the frustrating part, or that's where grief shows up, because now all of a sudden, it takes me twice as long to get dressed. And that's really frustrating. I didn't plan for twice as long to get dressed. And so there's the grief side of it, the big picture side of it. And then I think that there's those small, almost needing to relearn what my new pattern of life is that can be really triggering for many people.
Absolutely. And that is completely a valid statement, because change is challenge. Mm-hmm. Right? No matter what way you slice it. And like you said, most people seek to feel comfortable, whether it's plans for they had expected their life to turn out, whether it's, the comfort zone of how they autopilot different aspects of their life. It's really easy to compartmentalize our whole being when it's on these very comfortable, familiar planes. And so when something different comes into that, or a challenge or a change, I think that I loved your analogy of like, if you're in an unfamiliar city, you're naturally going to be more anxious for a myriad of reasons. However, you're also still in a new city, you still have things that need to be accomplished. You're not, it's like this age-old example of like, I can plan to go on a road trip and I can have all of these great, like, I'm going to, stop for gas here and there. But like, if you get a flat tire, you're not going to be like, oh, well, I'm just going to just walk away from the car. Like the car's done. Like you have to navigate that unforeseen challenge and continue along. with what is now happening in that moment.
Exactly.
And the learning process, right? So with my injury and my back, this isn't just, okay, take care of it and it goes away. It's just constant. Your whole life just changed, right? So this is, you have to go through the processes of grief, but then, for flare-ups, for example. So I have flare-ups. So you have to navigate that. And then, this whole new city, every time you go somewhere different, it's just the research and it's just the fatiguing exhaustion of researching. There's, we think about like, you were in the industry, you were a professional, but it's incumbent upon the individual themselves to do all this research to find out what are my options, what can I do. They're out there reading as much research as an individual, and that's exhausting. So let alone with something, from in my case where I have flare-ups. And it's just, it's quote unquote normal until it happens and there's a spike. And it's just, okay, on this day, everything that you thought was going to happen is done and it's changed. And it's, where do I go? What can I do? How do I get rid of the physical symptoms? And there's just that emotional symptoms and there's living with pain. So you go through the whole grief process to get to manage something daily. But there's also all of this other stuff that comes in that it just wears you out over time.
Yeah, I think you bring up like two other really good points that I didn't touch on too, which is that this uncertainty, right? Like living in the world of, I could be fine tomorrow or I could not be fine tomorrow. And so how do I live in that uncertainty of not knowing what to plan for, how much to plan for? And then also people don't get it. They might say they get it, but I think a lot of times when people live with diagnoses where there is unknown symptoms that may show up at any point, if you're not living with that and you haven't experienced it, the people around you often don't get it. Employers don't get it. Sometimes friends don't get it. I hear a lot of my patients say that, they'll say no to a couple of social outings because they're feeling fatigued or they're in pain, and then they stop getting invited. So that's really frustrating and sad, and all of that. How do you navigate having to now educate everybody as well about these symptoms? That's frustrating.
It's definitely frustrating, right? So you go through a myriad of feelings, but I just really love the cognitive overload that you brought up, because just the simply having to do the research and keep up with, what's going to be the next drop of the hat, like you mentioned. And then, it's a whole nother round of research, especially when you get into complex symptoms, or complex cases where you get into multiple symptoms. Every single symptom that you have, is this related? Is this normal? So sometimes when you get into something chronic, you don't know, you could be misdiagnosed for years. I'm fatigued. Yeah. Well, that's normal. Or you just, hey, you're anxious, go away. You're fine. So that happens quite a bit.
I had somebody recently who shared that she has MS, but she was having trouble with her dexterity in her hands. And it took her quite a while to get diagnosed with carpal tunnel, right? Because they kept attributing it to MS. She attributed it to MS, her doctors attributed it to MS. And it wasn't until she kept going back and, like you said, did all this research for herself that she figured out, like, this is not an MS thing. And that, it gets very complex, and you could get, kind of dropped through the cracks very easily in a medical setting.
I think you could get dropped through the cracks regardless of having a situation. I think this can make it just worse, which goes into, right, what about the times where you look fine most of the time? So this comes up to something that you brought up, which I thought was a really great topic. So you look fine most of the time, your friends don't really understand, so you quit getting invited. But then you may have these flare-ups, right, in some cases. If people don't understand what's going on with you and you're fatigued, do you think this has a part of ableism, right? And people having to navigate that as part of a challenge?
I think so. I really do. So, when I think about ableism, I think about, the environment that we live in is built for people that do not have a chronic illness or a disability, right? And so when you are navigating the world with a disability or a chronic illness, you're navigating the world in a world that's not built for you. And I think that many times people, if they haven't, like I said earlier, if they haven't lived with it, they don't have a family member with it, even sometimes if they have a family member with it, quite frankly. But if it hasn't happened to them, it's automatically sort of attributed to other things. Like she doesn't care about us, or, we're all fatigued, or, I get pain too, or those kinds of sort of dismissive comments. And I do think that there's a little bit of ableism in there, probably a lot, in the sense that, they're not thinking about a world where you have to navigate all of those extra layers of education and problem solving, when most of us don't have to do that. So we don't have that extra cognitive load.
Well, and I think too, like it just kind of really continues this cyclical experience around compartmentalizing and setting expectations on what medical care looks like in the should category, or what, somebody's expectations on like, well, they were always available before, or, like they're always doing different things when they can. So I think that it's really interesting to look at how do we fight against getting stuck in this expectation station, is kind of like what I call it, where it's like you're stuck at the station and there's like only one track that takes you one direction or the other. And it really starts to feed this all or nothing mentality. And to your point, that's a really isolating experience for somebody who's experiencing any kind of change, whether that's a chronic illness, a diagnosis, any kind of thing like that. And so much of what is acceptable from our form of care is like, well, just tell me how to fix it so I can get back on the tracks. And it isn't that way. When you're managing something that is chronic and unpredictable, something that worked yesterday may not work today. And then to your point, communicating that to the people who are within your life, that's fatiguing in itself. So what would you, from like a psychological perspective, say to somebody who is mentally and emotionally fatigued with trying to seek support for themselves, but also share in that experience with the people around them?
Yeah, it's complicated, and I think it's a little bit individual, but I'll share a story. So I do a lot of consulting work for an organization called Can Do Multiple Sclerosis. And one thing I really like about that organization is that they do a lot of focus on support partners. So people who support the people living with MS. And so there was a while ago, one of our educational events, we were talking about fatigue. And this man came up after the educational event and he said, my wife has been living with this for more than 10 years. And I knew that she talked about being fatigued, and I thought I got it. And then I sat in this room with all these other people talking about fatigue. And then I realized, oh, this is a real thing. Like, this is worse than me feeling tired when I wake up in the morning, right? So it wasn't even until he had the experience of hearing it from other people that it really kind of hit home for him. So to me, I think a big thing is community. As much as individual psychotherapy can be helpful for coming up with your own problem-solving techniques, or kind of oscillating between grief and figuring out how to manage these day-to-day challenges, community and groups are so important, not only for the person living with it, but the people that they really love and care about. Now, you might not be able to bring every single person that's in your friendship group to a group therapy type setting, but sometimes even just like a short YouTube video or a TikTok video, because I know Can Do is doing a lot of TikTok stuff now. And I think for this reason, right, like you need to be able to send information so that you're not having to do all of the education all the time, so that people can hear it from other people's perspective as well.
It's a really good point. Another one of the challenges, just in general, I feel like is stress, but you don't, bringing up this perspective of educating others around you on what's going on. I mean, that to me, that just sounds exhausting and stressful in of itself, because you don't want to always have to be explaining your different situation, right? Because I feel like it puts you at a place like, okay, you're the normal and I'm the abnormal, and you're trying to explain your way into this other world. So that alone, I feel like could be just beyond stressful. So I feel like the work that you're doing with that organization could be hugely valuable for members.
Yeah, they're a great organization. So, and I'm sure that there's others like it in other populations, but I think that emphasis on people around, the family members, friends, support partners is so valuable.
What other things would you say we could do, right, in terms of relationship management, right, with your family, your spouse, children? What other things are there for individuals to do in these situations, besides the education piece and bringing them to support groups, which may not be possible, but what else do you think people can do to help manage those?
Yeah, I have kind of three things that popped to mind when you were asking that. One is, I think, thinking about the people in our lives and what their strengths are and what their weaknesses are, and going to each person for their strengths. So if one person is the fun person, or the person I like to reminisce with, or is the comedian, if I need somebody who's going to make me laugh, I'm going to go to that person. I'm not going to go to the person who wants to fix my problem, right? If you want somebody to problem solve with you, you're going to go to the fixer. If you want somebody who's going to drive you to a doctor's appointment, you go to the person who may not want to talk about it, but they'll do the thing, that you ask them to help with. And so I think if you can kind of, and this is actually from somebody that I worked with, this is her idea. So I'm taking this from her, but what she said was, I just really had to look at all the people in my life and figure out what they were good at and go to them for the thing that they were good at, and not expect something from people where that was not their strength. So I think that has been kind of a really helpful suggestion for a lot of people. I think another thing is when you're having that kind of fatigue or chronic pain day or a flare-up day, not being too apologetic in the sense of, hopefully the people who love and care about you will still stick around, but, kind of offering an alternative suggestion. So that might be something like, today's not a good day for me, but, how about we do a phone call on Friday? Or today's not a good day for me. Can we just, watch party Netflix, the virtual Netflix party instead of me coming over, right? So if you can offer an alternative solution that works for you, sometimes that helps because it shows that you still care, even though today is not a good day. And you're also not overly apologetic for it. You're just, this is the reality that I'm living with. Right. And I know I said three things, but now I'm forgetting what the third one is. So I'll pause there.
It's okay. I wanted to bring up what I heard you say on relationship management, which hopefully Lauren jumps in, is really expectation management.
Yeah.
I think too, like it was brilliant when you said where it was like, when you look at the people in your life and when you look at these different support systems, whether those are medical providers, your family members or friends, you're looking at, okay, what are the strengths of the support systems that I currently have in place, as opposed to everybody needs to be a one size fits all expectation. And I think that like that is critical when looking at how to manage support in your life, where it's like, you don't go to your doctor like your doctor is not a dentist and your dentist is not a doctor. So why are we putting these expectations on friends and family members of like, no, you need to be my support system for my diagnosis, for when I'm having a difficult day as a parent, when I'm having, like, you have to be my everything. No one can be everything all the time. So I love that piece of advice. And then I loved the second piece that you touched on around like being unapologetic about the boundaries that you're lovingly putting into place. I think that there's such a stigma around boundary setting with people who are profoundly important in our lives because we're afraid that there's going to be pushback or shame or guilt associated with that. And so with an individual who's navigating the guilt, the grief, the shame of an illness or a diagnosis or whatever it might be, they don't need to add to that. So lovingly putting in a boundary that's like, hey, sorry that, today isn't going to work out for me. Does this day work for you? Like it's, you're not telling somebody like, well, you don't understand, like there's different ways to put in boundaries, but it's so important to be unapologetic about just simply communicating information and communicating your needs. There's no reason to apologize for a change in plans.
Right. Yeah. I mean, people change plans all the time. And I don't think that, you have to go in great detail and explaining every single symptom or, apologize or even feel like you need to provide that explanation unless it's helpful to you. So I like that too, that sort of loving boundaries. It's great. It's great face.
Yeah, absolutely. So managing these, symptoms and living with this, right? Is there anything that you have seen that really helps people when it comes to wellness? Like you get through, okay, so we've gotten through the stages of grief. We know we have these challenges. We're navigating this. When it comes to kind of management, right? So we know there's like the self-care, they need to incorporate these different techniques, right? From exercising, meditation, breathing, et cetera. Is there anything that you have from your perspective that just really helps with this managing and living with these conditions?
Yeah, I think, one of the big things that I focus on with the people that I work with is values. And what is important to you. And even if you're not exactly sure what that is, you can identify what are the things that I used to love to do. And then we can figure out why was that thing important. So there is an individual that I've been working with for a while who loves running, has been a runner their whole life. And then, with this diagnosis, now they're using an assistive device even for walking. And so we kind of delved into that, like, why was running important? Maybe it was because you were getting outside. Maybe it was you're getting a little bit of a break from the family and the chaos of the kids at home. Maybe it was the sun and the wind on your face. Maybe it was being able to run with the running group. And so that was that social aspect. And I think if you can kind of pinpoint what you loved about something, then you can kind of shift into how do I build that into a new way of living, right? I could still socialize, but maybe I can socialize in a different way, maybe with an adaptive skiing program or an adaptive sailing program. Or I can still be outside and get my exercise, but in, using a recumbent bike instead of running. Does it totally replace that thing that you used to love? No. But I think it can kind of pinpoint at some of those values that are really important. And it's just kind of shifting into a new way of being, something maybe you've never tried before. So values, I think, are really important for many of the people I work with. And then I think it's just sort of not having expectations that I have to feel okay all the time, because just because you accepted something, I think sometimes people think acceptance means that I'm never upset about it anymore. I'm totally fine with it. I've incorporated it into my life and I'm great. And I don't think that that's realistic expectation for anyone, right? Acceptance means, I'm kind of living with it day in, day out. I'm problem solving. It doesn't mean I like it. So I tend to think about sort of it's kind of a bringing in grief and expecting grief to show up sometimes, and also realizing that there's some flexibility and movement that you can incorporate.
Honestly,
I just love what you said.
Yeah.
Like, yeah. Well, because like when you think about it, what you're really speaking to is mindset, right? And there's so much power in the connection between our mind. It was one of the very first things that you started speaking about today with us, where it was like, this is truly one of the roots behind the passion that you have with this space. And I think that it's so profound to think about getting clear, not only on your self-awareness with reflection, asking yourself questions and leaning into the why behind something, whether it's why is there grief here or why is there difficulty here, but really laddering it down to what was the value or the priority? And how do I now adapt that, right? Going back to your explanation of like the puzzle piece, where it's like, how do I create space for this new piece in this tapestry that is my life?
And I just want to say, I think that's, and setting expectations and having realistic expectations. I think that's great advice for everybody, not just those living with a chronic illness. I think that's beautiful advice. Honestly, we could all take into consideration more often. But Lauren, you bring up adaptability. I think that's something that you need to have, the adaptability and resilience, living with this, right? Because every day is going to be something new.
Mm-hmm. Yeah.
Meghan, are there any, right? So pro in the field, psychologists in the field, are there any discoveries or insights, right? What have you discovered that you want to share with people?
Yeah, I think that a lot of discoveries are kind of rediscovering things that probably we've known for a long time, but in different ways. One of the things that I'm excited about now that I've been sharing with a lot of my patients is really focused around mindfulness. I started off as a neuropsychologist and really, on cognition and how do we improve people's memories and attention and all of that kind of stuff. And there's lots of great research that's happening now that mindfulness, which was a lot of times focused on stress reduction and all of that kind of stuff, is a powerful tool for improving cognition. And much of the research that I've been reading is that you cannot pull apart cognition from emotion. And so those two things are really intertwined. And so when you pull in mindfulness, it can be a stress reduction exercise because you're able to sort of redirect your mind from a ruminative thought to something that's happening right now in the moment. And just that exercise of moving your attention from one thing to the next thing is an exercise in attention and executive functioning. And so there's this idea that, if we can build in techniques that have multi-layer impact, that can have a huge impact on people with chronic illness that have emotional challenges and cognitive challenges.
What I think is so beautifully profound about that is like when we think about the point of a diagnosis or gaining information about an illness or combating an injury, whatever it might be, essentially we're seeking information. We just want support in the form of information. Help me feel better. Help me learn how to cope. Help me, whatever it might be. And I think that there's so much truth behind what you're saying, where it's like our bodies, our emotions is information. And there is knowledge to be gained and an awareness to be harnessed when we really look at that message, like what it's trying to say. I think so much of what people fear around stress management, chronic illness management, navigating changes is they don't know what they don't know. Yeah. But there is so much profound power that we can really empower people to seek for themselves with support, where it's like, what is your body telling you? What are your emotions telling you? Like, grief is here for a reason. Like, why? Analyze it.
Mm-hmm. Yeah, absolutely. Yeah. And I think just sort of pulling from one thing that you said is that, I think a lot of time that fear of the unknown, that uncertainty, if you can sort of practice the idea that I can problem solve around anything that shows up, right? Even if it's a really scary thing. So sometimes kind of working with a therapist to go into the worst case scenario and problem solving, how would I manage that? It can feel very scary, but almost being able to say, well, even if that worst case scenario thing happened, I could do A, B, and C. It gives you the exercise of being able to say that I will be able to manage this. I don't have to like it. I probably won't like it. It probably will be incredibly, I will grieve a lot or incredibly scary, but I can manage it. And so, yeah, there's a lot of uncertainty here. There's lots of stuff that people have to navigate, but practicing some of those skills can be very helpful.
Absolutely. And I think there's some meditation techniques, right, that you can go through very quickly, to handle these in these little periods of anxiety, right? Okay. Is this actually going to, be something that should be a terrifying situation? And when you think through the situation and you're like, okay, in the end, if this does happen, it's not the end of the world, go through these scenarios. I don't think that you always have to go to a therapist for that. There's a lot of tools and techniques and skill sets that you can have on your own and have these little tools in your tool bag. So if you get into these high anxiety or stressful situations, you already have these tools. You're like Lauren said, your body knows how to take care of itself, right? We just have to get the mind-body connection going together.
Yeah. Yeah. I always think, one of the things that I think about when I'm feeling particularly anxious, like if I am going to get up in front of an audience and talk or something, I always feel intense anxiety before that. And then I think, okay, I have a 5-year-old at home. I know that she's still going to love me and give me a hug when I come home. And so even if I totally flop, even if this is the worst experience ever, I'm going to have a hug from my 5-year-old when I get home, right? So I think sometimes if you can use that, so like you said, that meditation technique of putting myself in a different place or noticing that it's not all about this particular situation, zooming out to the bigger picture, sometimes that can help reduce, maybe not get rid of, but reduce and make that anxiety tolerable.
Yeah, absolutely. Well, and two, it goes back to what you were speaking on, where it's like, be clear on your values. If you value the time with your children in your example, that value far surpasses the value of performing well on a speaking event. It's not to say that you don't value both of them, but clearly one is sitting higher in your value system. I think that that's so great to say.
I think that's incredible. Can you speak to anything on mindset when it comes to, living with a chronic condition? How do you suggest people cultivate this new mindset that allows you to feel supported and embrace this new world?
Yeah, I mean, I think it's a little bit different for each person. When you're kind of getting stuck in the rut, of, I just feel like I can't get out of this, I think sometimes it's helpful to figure out where that's coming from. Lauren had mentioned earlier that idea of asking myself questions. So is this because I don't want to use that tool that I might have to use to be able to mobilize to a different place? Is that because I feel like, people are not supportive of me? Is that because I don't have a tool that will allow me to do this thing? I think if we can start to examine where the feelings are coming from, that can kind of help us problem solve through whether this is something I have control over or something I don't. But I guess I would go back to that idea of sort of oscillating, the mindset is oscillating between grief and problem solving or moving forward. And so the grief side of it is, maybe you set aside some time to journal about this or do a voice memo on your phone, or just, I'll give an example. There was a family, there was a couple who, I actually heard this on a podcast, but I really like it. They were talking about how the wife needs an assistive device for she uses an electric wheelchair, and her husband was helping her to transfer from one location to another. And she didn't quite get to the wheelchair and she fell onto the ground. And at first they were both, he was embarrassed, she was embarrassed because they were in a public parking lot. He was worried about her, thinking that she might have gotten hurt. So they spent kind of like 5 minutes doing that sort of check-in, being angry. Why do we always have to deal with these kinds of things? Both of them sort of checking in with all those negative emotions. And then they somehow shifted to both of them laughing, how ridiculous is this? And then they started joking around, and then they got to problem solving, like how are we going to, get back into the chair and problem solve this thing? So to me, that's such a great example of letting yourself grieve and naming those emotions and sitting with them for a while because they're real and that is frustrating and nobody wants to be in that situation, and being able to sort of shift out of that mindset and then move into, how do we problem solve this together so we can move forward? They're both real, but you don't have to sit in either one of them independently. It does take practice and reminders. And so I like to tell a lot of my patients that sometimes you might just have, 2 weeks where you feel sad, and like, let yourself feel that way. It's okay. If I get in a fight with somebody, it takes me 3 days to get over it. Okay. I'm going to recognize that if I get in an argument with somebody, I'm going to feel crappy for 3 days, and I'll just let myself feel crappy. And then on the third day, I'll say, okay, Megan, time to get over it. Let me shift my emotions. So sometimes it's kind of recognizing how long it takes yourself to process it and not pushing yourself to move faster than you're able to.
Yeah, I think that's incredible. And I think that too, that goes into kind of what you said before the show even, right? Which is something. So what is one misconception about living well that you wish you would have even learned sooner?
I think it's that idea that you don't have to make it all go away. It's okay to feel sad. It's okay to feel grief. It's okay to have those negative emotions. I mean, those are barometers for our life. If we didn't have those emotions, the good, happy, joyful moments maybe wouldn't be as powerful. I think a lot about, I'm a big Brene Brown fan, and she has this analogy of like the twinkle lights in the darkness, right? That sometimes living with a chronic illness can be like twinkle lights in the darkness, right? There's a lot of challenges, and there's those bright spots and moments where you can really hang on to joyful moments or really sit in those happy moments. And it doesn't have to be bright sunshine all the time for you to be okay.
Yeah, it's almost, as you were speaking, it just, the word self-compassion comes to mind. And there's so much validation and understanding that the emotions have information in them, but also like have this vision of waves, right? Where it's like some of the waves of grief or some of the waves of anger, whatever the emotion might be, maybe they're short, maybe they recede quickly, or maybe it is a tsunami and there is going to be monumental damage and devastation for weeks, months, who knows? It will recede. You will rebuild. There is both the destruction and the rebuild, and it's temporary, and it's okay to acknowledge that temporary, whatever the season may be, might be short, might be long. There is no expectation around it.
Yeah, I think Marsha Linehan said something to the effect of, the only constant is change, right? So,
I love it.
Yeah, I love that too, because, it might be a really terrible couple of years, and, maybe, and that will also change. So, and I think, in with chronic pain, we talk about people might be living, oscillating between a 7 and a 9, but when you're at a 9, it will come back down to a 7, and the 7 might be really terrible, but it's still maybe better than a 9. So how do you kind of look at those oscillations too? So yeah, I really like that analogy.
I think this is good for everybody to know. And I think that's why we're all here, right? For anybody, it's okay to not be okay. At any point in time. And we're all Brene Brown fans, but I think what you said was pretty spectacular. You said emotions are our barometer. So I think that was pretty cool how you framed, listen to your emotions. We have emotions for a reason. Yeah. That is just incredible. Well, is there anything else that you want to tell our listeners? I think this is incredible. Again, I think the biggest takeaway, right? It's okay to not be okay, but then how do you go to find resources to get through all these different stages so we can all live well with a high quality of life? So anything else you want to leave our listeners with?
Sure. I mean, I think podcasts and information like this is great. There's lots of great researchers and clinicians putting stuff out into the world. There's lots of great resources for different patient organizational groups. I also have a podcast, which is called Find Empathy, which is really geared towards mental health providers, kind of training them to work with medical populations. But I've also found that a lot of people living with chronic illness are listening to it as well. So hopefully both audiences will get some value out of it. But yeah, I mean, I think just kind of looking for resources out in the world and maybe, seeking out that community so that when you don't know how to problem solve something, if somebody else is living with that challenging condition, they might have some ideas, and just kind of, like you said earlier, building that toolbox.
Absolutely. Feel free to go to sophiahealth.com and also find, different types of providers for meditation, even if you need help with small things such as, stress or, tips and techniques for anxiety. There's a lot of resources out there available. I definitely agree with that. Meghan, if you want somebody to find you and connect with you on social channels, what channels would you like them to connect with you on?
Sure. So I'm on Twitter at Meghan with an H, Beier, PhD. Also, you can look for Find Empathy. If you just Google Find Empathy, you'll probably find it, or at Find_empathy on Twitter, Instagram, Facebook, and LinkedIn.
Okay, awesome. Well, thank you so much for being here and sharing this amazing information. I just really appreciate you being here and spending time with our listeners.
Thanks for having me.
Thank you so much for listening. This has been Sophia Unfiltered, a podcast by Sophia Health. I'm your host, Lauren Deitch. If you're interested in connecting to wellness professionals that can offer one-on-one support, visit sophiahealth.com or connect with us, our community, and providers anytime on social. If this episode resonated with you at all, we'd love to hear about it in the comments section of your favorite podcast provider or with a 5-star rating. Let us know what your biggest takeaway was from the episode, or share it with someone you hope to inspire. Join us again next time for more real conversations, stories, and insights that help empower you with the knowledge and inspiration needed to transform the way we take care of ourselves.